I'm delighted today to be joined by Dr. Greta Piculite of Moorgate Andrology, and today we're going to be talking about testicle replacement surgery. So, Dr. Greta, this is a procedure which Moorgate Andrology do quite frequently, but I understand that men come to Moorgate for testicle replacement for a variety of reasons, really.
Yes.
Why you might be missing one or even both testicles, but usually I think it's one. Tell me about some of the reasons that men come to Moorgate for testicle replacement.
It might be a wide variety of various conditions. For example, an oncological disease, when one of your testicles is removed. And usually
cancer.
it happens, yes, and it happens for young men, so it's really bad and a huge problem, both psychological and physical. Another reason might be not descended testicle.
And this undescended testicle, does this happen when a man is effectively a boy? Does it happen when they're children?
It's a congenital condition. So
you're born with this?
Yes.
Okay. So tell me, apart from oncology, what are other reasons men might need to replace a lost testicle?
Some of men might lose the testicle due to trauma. Other might have a problem since the early childhood, as one of the testicles or both of them haven't been descended.
Okay, so it's great that the testicle can be replaced.
Yeah.
And what is the, shall we say, the replacement testicle? What is that? What are they made of?
It is an implant, and it's usually really similar to one that women put inside their breasts to make it bigger. It's
so silicone-based
same.
implant.
Yes, it is.
Okay. And in terms of size, do they come in different sizes? Presumably we're going to try and match that testicle to the real one.
That's right.
So that the two look.
And there are various
good.
brands which are slightly different.
Okay. And how is the procedure performed? Are you asleep when you have this done? Is it a general anesthetic?
Usually you would be put to sleep, but it might be carried out under the local anesthesia as well.
Okay.
Anyway, you make an incision in the scrotum, and it's a normal surgical procedure, just it might be carried out under local anesthesia as well.
Okay. And when guys have had testicle replacement surgery, presumably if they have their own other testicle, they can still father children and so on?
Yes, that's right. You need at least one testicle to do that.